So I'm Meghan Campbell. I'm one of the nurses that's been working in teen clinic in Bega, and here's a little bit of our story so far. Hi all. I'm missing a slide. This is an internal message that I sent to around our practice in February 2015. Quite a naive message, I have to say. Hi all. As you're aware, we have had some recent deaths from suicide among young people in our town. We've been thinking of ways that we might be able to improve the access young people have to our team. We're thinking of starting a drop-in clinic for teenagers. We'll open 2 afternoons a week where the nurses are free for teenagers to drop in and chat. By doing this, we aim to improve access to young people have to our high-quality healthcare and be able to provide timely access to contraception, STI screening and early intervention to mental health services. But along with this, it's also important to know they'll be able to attend for any issue at all. We'll allocate time in the appointment book for GP follow-up the following day as needed. There may be times when we need you to pop into a drop-in clinic on the day. We'll have a meeting with the school about the times and the needs on Thursday at 1 o'clock. It would be great if you could be there. Keen to hear your thoughts around this before the school meeting. Thanks, Meghan. Oops. I might recommend a little more consultation prior to sending a message like this. Not many practices that you could send this message and not create panic stations. The process of starting this clinic has been a huge learning curve and has required continued vision and determination from the team, and a lot more consultation since then. We've got GP practices around the country with highly skilled, experienced nurses in them who are often underutilised. If we sit down to think about it, these nurses, us, are quite hard to access, especially for this group in our community. When I think back to when I was transitioning to go to the doctor on my own, I actually rehearsed with my mum what I was going to say when it came to paying and how I was going to approach the doctor and what I was going to talk about. There's a lot of young people who don't have that support. They don't know if they're allowed to go to the doctor by themselves. They don't know how much it will cost. Ringing up for an appointment is a massive barrier for these people. By making a small change to the access these people have to our nurses, those barriers become a little bit smaller. For the nurses in our practice, teen clinic is the best time of our week. When someone asks, "How was your day?" we can truly answer that, "I think we made a difference." One of the examples that comes to mind was a 16-year-old homeless girl, no longer at school. She'd attended her local GP because she was pregnant and didn't want to be. Her GP had told her that the only way for her to access a termination was to travel to Canberra, 3 hours away, and pay $500. For this person, this was totally out of her reach. It was also incorrect information. A friend of hers told her to attend the teen clinic and see what we had to say. We were able to access something locally for her at a fraction of the cost. When we started teen clinic, we wanted it to be somewhere that young people could come for information. As savvy as these young people are, I've been really surprised at how misinformed they are regarding simple things like their menstrual cycle, or how high their chances are of falling pregnant if they're having unprotected sex. It feels really good to be able to give them accurate information that has the potential to change the trajectory of their life. Having reception on board is key to this model. They must understand that their critical role in this access. Their friendly face when a young person walks through the door is essential in letting that young person know that they're welcome. Reception staff manage the appointment books so that we have access to GPs, psychologists, appointments in a timely way. Confidentiality is huge for these young people and of particular concern in regional towns. We've provided education to the high schools, letting the young people know what our boundaries are with confidentiality as health professionals as well. Our staff also handle the teen clinic presentations and inquiries with extra sensitivity. Teen clinic doesn't try to be everything to everyone. It's important that the teen clinic nurse builds relationships with other service providers in the community so that referral pathways are as smooth as possible. We don't want to replicate services that already exist, just improve access to them. Teen clinic is a soft entry point for referral to other services. As a nurse, we often fall into the fix-it mentality, and this can be a hard shift when you start teen clinic. One of the psychologists we work with said that these kids, they don't know what healthcare looks like, and we can help teach them. We don't have to solve everything in one day. We need just to provide genuine, welcoming environment to engage the young people, showing them that they're important and that we're listening. You don't even have to be cool to be a teen clinic nurse. Just genuinely interested in them. What they bring to the teen clinic is their truth, and I've found that teenagers aren't really as scary as I first thought. There's still young people that attend their usual GPs in our town, which is great. There are still teenagers who choose not to access teen clinic. We're just simply opening the door as an option. We have young people that come with their parents, with teachers, with friends, or on their own. This is one of the things that I love about this model. There's no stigma as to why they might attend teen clinic. They can come to teen clinic with an ear infection. As you can see from the graph, most often it is mood, STI or contraception. However, it's really important that the message in the community is clear. We realise that they may end up sitting in the waiting room next to their neighbour. We want it to be normal and healthy for young people accessing healthcare, just like it is for the rest of the community. The benefits of being set within a general practice with highly skilled staff on hand and no downtime. If no one attends teen clinic one afternoon, the practice nurse gets on with all the other things that they need to do. We also think it's a great safety net. Teen clinic in our practice runs 2 afternoons a week. However, should someone turn up outside this time, reception are well aware never to turn anyone away. They always need to be triaged by a nurse. So on the ball are our reception staff that we had a young person turn up with an implant on. They plonked it on reception desk and they said, "Can someone put this in?" This was not during teen clinic time, and it was a usual, normal, busy day, and everyone was running behind. Reception said, "Have a seat, and I'll get one of the nurses." That young person had got the script from elsewhere, and then found out that it was going to cost her $220 to have it put in. She had plans for a music festival in a week, and she really wanted the contraception on board. She was planning ahead and trying hard to keep herself safe, but she just couldn't afford the $220. We all saw the high need to get this in as soon as possible. And we did. It was a small addition to our day, but potentially one of the most worthwhile things we did that morning. And they're the stories that I really love about teen clinic. At first, when I look at teen clinic in relation to the building blocks, I thought, oh, we didn't really do that. We just started teen clinic. However, when I looked through the steps, we absolutely did address these. The one that's difficult with most nurse-led clinics under the current system, and especially with ours, is the funding. And I think it's really difficult for us to measure our outcomes for such an early intervention model. We can't prove how many pregnancies were prevented or how many serious mental health issues were averted through early intervention. We have looked to things such as the APNA grants, our PHN, and also community services like Rotary and Lions to support this model. And we have found great community support for our teen clinic.
I believe that it's saved lives, has saved lives.
I think it works because it's so simple, it's so accessible.
It's not a sexual health clinic, it's not a mental health clinic.
Service like teen clinic makes it really, really easy and accessible, and I think that's why it's so popular with young people.
Like, you have that sense of kind of autonomy, and that like if there is something that I don't want to go to the doctors with my parents about, I can just go and it's fine and it's easy.
I think it's addressing a real need in our changing society today.
So Teen Clinic is a drop-in clinic for teenage kids. That runs 2 afternoons a week, and the beauty of that is that it's a nurse-led clinic. That means they don't need appointments, they don't need a Medicare card.
A regular doctor's surgery is seen as an adult environment, and it is run by adults, it's full of adults, and I think most kids would feel at least a little intimidated by that.
Teen Clinic is a nurse-led service, and we think that for teenagers that's actually a great advantage, because we think that we're possibly a little bit less daunting than doctors to speak to. They probably know more nurses, they've probably got more friends whose mums are nurses.
It's very relaxed, you know, and young people can just drop in as the need arises.
You don't have to call in and make an appointment. It gives agency to young people. Yeah.
Teenagers aren't sort of particularly great at keeping appointments and sticking to times and making appointments, so to have that walk-in approach just really works well.
Some teenagers can't go to the doctor with their parents. It's just how it is.
Confidentiality is key for the kids. In the vast majority of cases, it's going to be in their best interest of the kids for their parents or their carers to know about it, but there are a small number of cases where that's not the case.
There was a part of me that was going, I'm not sure whether I want Indigo to be keeping this information from me. But what I value much more than, my having that information is the fact that she feels safe and comfortable enough to go.
No problem, or nothing that a teenager brings is unimportant. Everything they bring is important because it is important to them.
It's totally holistic, and that's the beauty of it. It's not mental health, it's not sexual health, it's everything.
Acne or warts, or they can come with concerns about contraception or their first sexual encounter, which is concern, as well as family and emotional problems, bullying, housing issues. There's a whole range of things that young people will present with.
You go to the teen clinic maybe if you have a cold, or you go to the teen clinic if you, had an unprotected sexual encounter. But what I think is really crucial is the fact that it certainly mental health service as well.
Kids who are risk and getting them through the door, and then the level of care that they receive, and then further engagement, linking them with other health professionals, those kids are now safe and alive and will go on to live happy and safe lives.
I think the health of our next generation is a community responsibility.
Teen clinic is absolutely vital as a kind of frontline mental health service next to it.
It feels like very much a local solution, almost a local solution to a global problem.
Some of them are so chaotic, and it's just lovely to be able to help them sort of take that down and think about their lives.
Look, we all want to do something that's meaningful and purposeful in our lives, and we all want to make a difference. That's why we're in healthcare. And what better place to be able to intervene or make a difference in someone's life than at this stage of their life. It has such long-ranging ramifications. If you can support and mentor someone at this stage when they're struggling, then I think that you'll set them up for life.
Can we replicate what we've done in Bega? Absolutely. There's a massive need in rural and regional towns around Australia for better access to youth-friendly health services. We believe this model makes an efficient use of the Medicare dollar and it utilises existing infrastructure and clinicians. In the last 9 months, 4 new teen clinics have opened up in our area as a pilot supported by our PHN coordinator. We're interested in what works and what doesn't. From this pilot, we want to know what the real cost is in a teen clinic startup. The major factor in the success of this rolling out further is funding a model that supports nurse training. Given the efficiency of this model and the potential benefits to the community, we endeavour to do everything we can to put nurse training at the centre of any future rollouts and funding applications. It's our vision that we will lobby for funding that can be attached to teen clinic accredited nurses. These nurses will have completed a specific set of training and will work under standing orders for things such as simple STI screening, contraception commencement, and be able to refer to mental health providers for counselling services without the need for mental health care plans, which requires a diagnosis. Often these young people just need someone to talk to for a short while. These may be really lofty ideas. However, what a great time in primary health care to put services for young people at the fore, while at the same time showing what primary health care nurses can do when they're given a little autonomy. Thanks.
Thank you, Megan. Just stay there. I'm sure we've got time for 1 or 2 questions.
Hi Megan, I'm Joanne, the nurse practitioner at Junction Youth Health Service in Canberra. And I guess when you talked about funding, one of the things that I was kind of interested in was you received government funding for the teen clinic?
No, so I mean, when we first started, we just started. And that was just, the only reason we could do that was because the practice principal, Duncan, was happy just to absorb the cost and see what happened. And then we applied for the APNA Enhanced Nurse Clinic grant, so we got that, so that helped us along. And then in the last 12 months we applied for our PHN coordinator for the rollout funding. But other than that, it's just if they do see a GP, an item number is generated, and if they don't see a GP, there's no item number.
And referral pathways from within the clinic, obviously, is it more asymptomatic clients that you're seeing, or and then referring beyond symptomatic?
So for STI screening, you mean, or? I mean, we manage it all in the teen clinic. So once we've seen them for their screening or worked out what's needed, the GP will be included in that for follow-up.
Okay, so I think
Sorry, you may say at the beginning, what actually prompted you to want to do this?
So we'd had a spate of suicides in our town, and we were just literally sitting around the staff room going, God, why aren't they coming to get help? What's going on? What can we do to help them? Because in our town there was no youth-specific services. No, it was all just sort of very GP land. Yeah.
I think it was one. Okay, last one.
Well, I think like everyone else, I just loved Indigo's response to her
I know.
But I'm really curious to know that, so it's within your general practice, so the teens are more than happy to just present at the general practice still?
Yeah, so, I mean, when we started, we knew, we saw that there was pros and cons with it being set within the general practice. And so we just we couldn't do anything else because we had no money and we had all these resources here and skills. So we decided we'd just work on communication with the school, building trust, worked on reception staff, just made sure they understood what this was about. And they, you know, like I said, I'm sure we're not capturing everyone, it's just an option. But they do seem fine, and we sort of worked on that presentation to reception was really important. So we had all they need to do is say, hi, I'm here for teen clinic. So they don't have to give their name necessarily. Most of them are happy and with reception just gets basics, name and date of birth, if they're happy to give that. But otherwise they just say, there's someone here for teen clinic, and then the nurse will get that in the room so that it's private.